Hallucinations are interesting, and I discovered it indirectly. And I began to understand it because when treating patients with hallucinations, I began to have the effect that the hallucinations would disappear. I'll give an example. I was at a hospital where I gave a speech, a grand round, similar to what I just gave to you. And after the presentation, I was approached by the psychologist, the OT, and the PT that said, I've got to see this patient before I leave. Went off to another room, and they brought this man in. He was in a wheelchair, and he was screaming, get him off me, get him off me. And he was literally flecking at his arms and trying to swipe away at these things that he was hallucinating at. I started talking with him, and I said, well, what are you seeing? And he said, I'm seeing these brown green things. They're coming at me. Well, it just so happened that the rug was filled with giant brownish greenish pine cones. I recognized he had post-traumatic vision syndrome after a brief screening, and I took prisms, placed them on his face, and within 2 minutes he sat back, and I asked him what happened to the monsters, and he said they were gone. A week later, I was called in my office because I'd left him with some prism glasses, and the psychologist, PT, and OT were on the line, and they asked me if I remembered that patient. I said I did, and they said since I had given them the prism prescription, he hadn't hallucinated, and they were bringing the psychiatrist back in to see if they could take him off of the psychotropic drugs. What happens there is that when the focalization process locks onto a detail and you lose the plasticity for allowing you to make a change of movement with your eyes, any movement of your eye gets projected out into what you're looking at. For this gentleman, as he was looking at the rug pattern, if he moved his eye or his body, he projected that movement out. The movement of these patterns, then he began to interpret differently in terms of not just a pine cone, but something alive. I've had patients where a lolly column or a vertical line on a wall suddenly turned into a giant snake that was slithering down the wall and coming at them. Treat them for the PTVS, and suddenly that becomes stable, and they no longer see it as a snake. So hallucinations are there because of a projection of movement, usually by the person, through either their eye movements or body movements. The visual process projects that movement into the environment, and they interpret it as something like a monster. I've had giant bugs on pizza pies, which were nothing more than pepperoni. Monsters jumping into pools after people, which were vertical lines. A lot of strange responses.